So what made you suspect asthma?
It was when, after he had pneumonia, and he was doing that abdominal breathing, and then he had to start breathing treatments, and just every time he gets sick, he has a hard time breathing.
When did he get the pneumonia?
He's about 3 years old.
3 years. Okay. And how old is he now?
5.
The risk factors in Lincoln that may contribute to asthma are pollen, irritants, dust mites, household pets.
Does Vinny have any triggers for his asthma?
His allergies, and every time he gets a cold.
What helps him get better when he has his triggers?
Breathing treatment, sitting in a steamy bathroom.
Do you have to provide the school any education for his asthma?
Not so far, but probably when he starts kindergarten, I will.
What kind of information will you provide once he starts kindergarten?
Just that he has asthma, and that he might need inhalers and breathing treatments throughout the day.
Mm-hmm. Do you plan on bringing like an extra set there to like the school nurse? Is that how it typically works?
Yeah, I think so.
Yeah.
Do you use any community resources to get your inhalers and breathing treatments, or do you just get it yourself?
We just get it ourselves.
So the 3 priority problems that are associated with asthma would be activity intolerance, ineffective airway breathing, and lack of knowledge for people that are around Vinny that aren't his immediate family. And we said that our main priority problem would be activity intolerance because he is so small. He's only 5 years old, and at that young age, he's wanting to play outside with his friends and be as active as possible. So that would be his biggest problem.
So the patho of asthma, when a person is exposed to allergens or irritants, it initiates the inflammatory cascade involving cells such as mast cells, macrophages, eosinophils, neutrophils, T and B lymphocytes, and epithelial cells. The inflammatory mediators cause capillary permeability. The nerve cells cause itching. Smooth muscle cells cause bronchial spasms, and goblet cells with mucus production. So the airflow is then limited because the inflammation causes bronchoconstriction, hyperreactivity, and edema of the airways. Eventually, remodeling can occur in the bronchial walls due to chronic inflammation, and changes can occur such as fibrosis of subepithelium, smooth muscle hypertrophy of airways, mucus hypersecretion, and angiogenesis, which is proliferation of new blood vessels.
Asthma would be like coughing, dry and hacking coughing while sleeping or early in the morning, wheezing, breathlessness or chest tightness, prolonged expiration, but it can vary depending on the individual too, so each attack is individualized.
What are some of the symptoms that he experiences?
Difficulty breathing. He gets that croupy cough every time he gets sick. Abdominal breathing, and then he flares his nostrils.
Were there any factors that may have increased his risk for asthma?
Family history of it. His dad had bronchitis when he was little. And then his aunt has horrible asthma.
What about living conditions? Is there anything that would contribute to it?
No.
3 needs that we identified for Vinny with his asthma in relation to the activity intolerance. First, he needs to have medication available at all times, such as albuterol. Second, education needs to be provided to the people around him as far as signs and symptoms of an asthma attack to be able to recognize it when it might be happening. And 3, being able to treat an asthma attack if it is happening, like taking him inside and giving him his meds.
These 3 needs are supported by a story that Randy told us about when she took Vinny to a park one day, and the pollen count was really high that day, and she noticed that Vinny was having difficulty breathing and that he was squatting over and showing signs of distress. So she took him to the car and let him sit down and gave him his breathing treatment.
For the psychosocial aspect of it, babysitting Vinny, like family members that don't know a lot about asthma or aren't in the medical field, like my mom, can get really stressed out when he's sick and he starts abdominal breathing, or he's outside and he's playing and he can't breathe. She kind of panics and doesn't know what to do, whereas my brother, who's a paramedic, or me, who's in nursing school, would have the tools or like the knowledge to initiate a breathing treatment or give him his inhaler.
Some community resources that are available for Vinny would include his primary care provider, the Allergy, Asthma, and Immunology Association, and his school nurse once he starts kindergarten. Every Nebraska school is required to have a nebulizer compressor, and that would include the nebulizer cup, tubing, and albuterol for nebulizing. Some strategies to enhance self-management include using the teach-back method with Vinny about using his medications and rewarding him when he does them correctly, and making the treatment fun and interactive so that he is willing to sit through the treatment. Do you have any goals for the management of Vinny's asthma?
Just for him to be able to go outside and play with other kids without having an asthma attack.
What do you want us to know about this disease when we are practicing as nurses?
The signs and symptoms of an asthma attack, how to correctly give the asthma medication, and to be able to give correct information about it, because we had a nurse at the hospital that just gave us really incorrect information about what I was supposed to do with the breathing treatments.
So to achieve the goal that Randy gave us, we would want to educate everybody that's going to be around Vinny, including like other friends, parents of other children, to recognize signs and symptoms of an asthma attack to stop it from progressing to hospitalization or something further.
3 nursing implications for pediatrics with asthma would be not giving them aspirin, using teach-back technique for the inhaler administration of albuterol, and being attentive to social concerns like at school and trying to keep it as normal as possible. And then for the last one, exercise-induced bronchospasm, so giving their albuterol treatment 5 to 10 minutes before activity.
Vinny's parents are well educated about asthma, but there are some self-management gaps, such as Vinny being so young and needing his parents to assist him with the treatment, such as pouring the medication out into the nebulizer, and him not wanting to miss out on activities and what is going on to come in and take his treatments.
Vinny's had 2 hospitalizations. Can you tell us about those experiences?
The first one is when he had croup, and we went early in the morning because the doctor's office wasn't open and he was having a hard time breathing. And they gave him Benadryl for his cough, and then they gave him a steroid shot and an antibiotic shot, and then he actually did really well after that. The second one was when he had pneumonia, and my husband had taken him to the doctor's office. They gave him a breathing treatment there, sent him straight over to the Bryan East, and he had to stay overnight and get a chest x-ray.
How old was he in his first hospitalization?
He was 3 for both.
3 for both.
What medications do you typically give Vinny?
He gets allergy medication every morning, and then we give him albuterol whenever he seems to be having a hard time breathing. All right, Vinny, come here. Here, get up here. You want turned on? Here, okay.